I'm going to talk through combined hormonal contraception. So this includes the pill, the patch, and the vaginal ring. All of these contain two hormones, estrogen and progesterone, and they're just delivered in different ways. So the pill is obviously the most widely known form. A pill pack usually comes with 21 tablets. These are taken one a day, ideally at the same time every day. The patch delivers the medication through the skin. The patch is changed once a week. And then the vaginal ring is just a thin plastic ring that is inserted into the vagina and removed after 3 weeks. So the main way that the pill, the patch, and the ring work is by stopping ovulation. So they stop an egg being released every month, and then they stop your normal menstrual cycle. They can be used in different ways. So traditionally, I suppose, people would have taken the pill every day for 3 weeks and then taken a week off. We now know that you can take it continuously. So when you stop taking your pill or your patch or your ring, you will get a withdrawal bleed. This is like a period, but it's not a true period, because you're not having a normal cycle. It's just from a sudden drop in the hormone levels. So now what we advise is that you take your pill, patch, or ring for 3 weeks, and then you have options. So you can run straight into the next pack, straight into the next packet of pills or the next patch, or just change straight away for another ring. You can do that continuously. Sometimes people might get a breakthrough bleed eventually if they are using it continuously, and if that happens for 2 days or more, you're as well to give yourself a break. So that would be a 4-day break. Alternatively, you can take a break every month, generally a 4-day break, so take it at the end of your pack, and usually again you'll have a withdrawal period during this time. Some people like the reassurance of having a bleed every month just so they're sure they're not pregnant. Alternatively, you can take 3 packs back to back and then give yourself a break. So the other thing to mention is that there are different doses of estrogen in the pills and different types of progesterone, and so they might have different side effects and different benefits depending on which ones are in it. There's really just one type of patch called Evra, and there's one vaginal ring called the Nuva ring, available in Ireland anyway. So yeah, and then the other things of note are the other benefits. Obviously, it provides very effective contraception if it's used properly, but there are other benefits as well. So people who have really painful periods, very heavy periods, or get very bad PMS can really benefit from shutting down their normal cycle. And then usually the periods will be much lighter, or they might go away if it's being used continuously, and the PMS symptoms should settle down as well. I mentioned that it's important to take the pill at the same time every day. If you miss a pill, the main thing is to just take the pill when you remember it, even if that means taking 2 pills on the same day. If you miss a pill close to that 4-day break, that's the highest risk of having an unplanned pregnancy. If you miss a pill in the last week of the packet, just run straight through to the next packet without a break. If you have any concerns, you're as well to contact your pharmacist or your GP, and then they can advise whether you need a morning after pill. There are some people who can't take the combined pill for various reasons, so we'll always go through your risks in the consultation to decide if it's suitable for you. But just to mention some of them, so combined contraception with estrogen and progesterone in it can increase the risk of breast cancer, and it can also increase the risk of a clot, like a clot in your leg, a DVT, or a clot in your lungs, a PE, pulmonary embolus. So the main risk factors that we would think about are being a smoker over the age of 35, having a BMI over 35, getting migraines with aura, and also if there's a strong family history of clots in your family in people under the age of 45, that is significant. Or obviously if you've had one yourself. personal history of breast cancer would be a contraindication, but family history isn't. You just have to think about your own personal risk of breast cancer if there is a strong family history. But all of those things will be discussed and assessed in your consultation. If you're on a combined hormonal contraceptive, we'd usually see you after 3 months after starting whichever contraceptive it is, just to see how you're getting on. Sometimes we need to change to a different brand if you're getting side effects that you can't put up with. It can take trial and error to find one that suits you. Some side effects can vary from person to person or from brand of pill to brand of pill. But then once you're on a contraceptive that you're happy with, we can issue an annual prescription, and we just need to see you once a year to check your blood pressure, check your weight, and check your height, and to see that there's been no change in your personal risk factors. So yeah, that's it. If you have any questions or you would like to start a combined hormonal contraceptive, you can make an appointment to see us in the clinic.